Well, hey guys, are you randomly getting painful pimples on the body? I'm a dermatologist, and in this video, I'm going to explain why this is happening and how to get rid of it. When you see what you think is a pimple on the skin, there's a good chance you might think, acne. Acne is a super common skin condition. It affects like 80% of adolescents and young adults. It also can persist into adulthood. But as I've said on this channel before, not everything that looks like acne is acne. And these painful pimples that are randomly happening on your body, there's a good chance it's something called folliculitis. What's folliculitis? Folliculitis is inflammation around the hair follicle. You see, the hair follicle is where acne happens, but a lot of other skin conditions can happen there too, including little bacterial or yeast infections in the follicle that lead to a painful bump, can have pus, and it looks like a pimple, but it's totally different. And the approach to preventing it and getting rid of it is much different than the approach to treating, say, acne, for example. When you think about acne, truthfully, acne, it can definitely happen anywhere, but it's most commonly going to happen on the face, the chest, and the back, whereas folliculitis really can happen anywhere where you have hair. And we're mammals, so we're covered in hair, except our palms and our soles and a few other locations. So that means you can get folliculitis pretty much anywhere on the body, but it's most common in sites where you have a lot of friction. Frequently happens on the lower legs, the skin folds, under the breast in women in particular, in the groin area, and it can happen on the buttocks. And it's also a lot more common anywhere where you have a lot of skin friction. It also frequently pops up anywhere where you may be attempting to remove hair, like your legs, the groin area, or under your arms. It's more common in the spring and summer months. Tip number one for clearing this up is tend to your razor. Your razor blade may be the culprit in introducing infectious microorganisms into the skin, either because a biofilm has formed on it, or it's just dull and crummy and worn out, and it's irritating your skin and making it so that the bacteria have an easier time getting into that hair follicle.
In some cases, taking a temporary 6-week break from shaving and just letting the hair grow out can really help with resolving the folliculitis.
Now, one mistake a lot of people make when it comes to their razor is keeping it in the shower or setting it down next to a wet sink. The moisture dulls the blades and can lead to bacterial infections very easily. So make sure that you don't leave your razor in the shower or by a wet sink. Always take it out. Make sure you let it dry fully. Make sure you're changing out your razor frequently enough. Nothing will trigger a folliculitis faster than a dull razor. Whenever you shave, make sure to lather the area with like a shave cream or a shave gel. This is not only going to make the hairs easier to cut, but it's also going to protect the surrounding skin from nicks. And make sure that you take short strokes and that you don't press too hard. This is a common pitfall actually when it comes to shaving your pits, people press too hard. You see, when you lift your arm up like this, the armpit kind of pops out and the skin becomes very tight. You might press down really hard, and that actually can be pretty irritating. So go real gentle when you shave under the arms especially, but really anywhere. Take short strokes and don't press too hard. And importantly, after you finish shaving and you rinse off that shave residue, apply a lightweight moisturizer. This is going to help hydrate the skin and help with replenishing the lipid barrier. By applying a lightweight moisturizer after shaving, it's going to help with restoring the skin barrier so that it keeps those bacteria and yeast out of the pore. Let's talk about your towels and your bed linens. They may be harboring bacteria, and with the friction of the towel or your bed sheets up against the skin, it could introduce that into your skin. So make sure you are washing your linens frequently. An issue you may be running into and not realizing it is that, say for example, the towel that you use after you get out of the shower, a lot of people will just hang the towel up in their bathroom and use it a couple of times. No problem there. But if you're dealing with painful breakouts, you might want to reconsider that and change out your towel, maybe even on a daily basis, because certain bacteria can be harbored in the towel, especially if you don't have good circulation in your bathroom and it stays humid, you don't have a fan in there. Well, that moisture can create a favorable environment for bacteria being trapped in your towels, and then your reintroducing that on the skin surface each time you reuse that towel. Speaking of which, don't share towels or linens if you are experiencing frequent breakouts of painful pimples on the body, because the bacteria that can cause these painful breakouts, it can be transferred from person to person through things like towels and sheets. So make sure you're laundering your linens frequently. You know, a lot of people talk about washing your pillowcase. They place a lot of emphasis on pillowcase hygiene all over social media as a way to help clear up acne breakouts. But take a look at all of your linens, because a lot of people sweat in their sleep. The sheets may be trapping bacteria admixed with your sweat, and you may not realize it, but your sheets may be harboring some bacteria that is causing painful pimples on the body. Number 3 is to start bathing with a benzoyl peroxide wash. I'm a huge fan of benzoyl peroxide washes. For example, Panoxyl is one I frequently recommend. Now, these are actually acne treatments, but they can help with the folliculitis. Even though they're different conditions, this treatment can help with both conditions. So even if you're not clear what it is you're dealing with, a benzoyl peroxide wash may be helpful in either scenario. And the reason benzoyl peroxide washes are helpful is because benzoyl peroxide reduces the burden of bacteria on the skin surface that could travel down into your pore and cause folliculitis. And benzoyl peroxide also cuts down on the burden of the acne causing bacteria, Cutibacterium and acne. That's why it works for either condition. Now, benzoyl peroxide washes, you should just lather them to the areas where you're experiencing a lot of breakouts. Maybe it's under the breast or around the breast, in the underarm area, the buttocks, the groin area. Lather it there, let it sit on the skin for a few minutes while you're in the shower so that that benzoyl peroxide really has a good contact time with the skin surface, and then rinse it off. Another benefit of using benzoyl peroxide washes under the arms, a lot of you guys who have watched my videos already know this, but you'll find that it really helps cut down on body odor because it reduces the burden of bacteria in that location that break down your sweat and contribute to body odor. So that's another added benefit of benzoyl peroxide washes. When you get out of the shower, make sure you are moisturizing the skin. A lot of people who experience either acne breakouts or folliculitis become very moisturizer phobic because they feel as though that is the contributing factor. But moisturizers can really help with restoring any disruptions to the skin barrier after bathing, after shaving, after using a benzoyl peroxide wash, which while effective can be drying. And by helping to restore the skin barrier, it ultimately is going to help prevent those little infectious microorganisms from trickling down into that hair follicle and causing recurrences of these bumps. So as part of your bathing practice, make sure you're using a body moisturizer regularly after bathing and after shaving. When people experience painful breakouts, they're very quick to scour the shelves looking for a skincare product that will help them out, clear things up. But critically evaluate your clothing. You see, one of the possible reasons why folliculitis is a lot more common in the spring and summer months, possibly related to people shaving more, but also people tend to gravitate to more form-fitting clothing in the spring and summer months. And that form-fitting tight clothing can trap bacteria up against the skin surface. It also causes a lot of friction, leads to the hair rubbing back and forth. It can get a lot of irritation around the hair follicle, welcomes bacteria and or yeast in with open arms, and that can lead to really painful pimples in the groin area, especially between the thighs where the thighs rub, under the breasts. It's not uncommon for people to get folliculitis on the buttocks, especially if you wear a lot of tight clothing, jeans, workout shorts that don't really breathe particularly well, or that are trapping sweat up close to your body. When you get sweaty and the sweat is getting through to your clothing, change out of your clothing into something dry, because that sweat really disrupts the skin barrier even further. That tight clothing is going to trap that sweat up against the skin, further irritating things. So consider switching over to more loose-fitting, breathable fabrics that aren't so tight, so form-fitting, that don't lead to so much friction on the skin surface. That's actually another good reason to moisturize your skin regularly that I didn't mention. but the moisturizing of the skin really helps lubricate the skin surface, cutting down on friction from, say, clothing. Speaking of sweat, don't sit in your own sweat. Sweat, again, left on the skin surface, the salt in your sweat actually starts to disrupt your skin barrier. So don't sit in your own sweat. This is actually easier said than done, because in real life, at your job, up on your feet, and all of a sudden you're breaking out into a sweat. You can't just, it's not realistic to just jump in the shower, but as best you're able, try and stay dry. Again, the loose-fitting, breathable clothing will help with that as well. Don't shy away from antiperspirants in the underarm area to reduce sweat production, because that ultimately can help in cutting down on the risk of folliculitis. But a product that I am rather a fan of for on-the-go purposes, for when you do get really sweaty and it's just not practical to like jump in a shower, rinse off the skin, rinse that sweat off, is hypochlorous spray. Kind of smells like dilute bleach water, but it's anti-inflammatory, and it's a really nice option to just spray. Like, you know, a lot of women deal with collections of sweat under the breasts that start to break down the skin there, and they get colonization with bacteria, yeast, all sorts of painful breakouts that can happen there. So if you deal with those kinds of things, you know, spraying this hypochlorous spray under the breast, fanning the area, patting it dry, it can really help not only in, you know, removing some sweat on the go, but it also can help prevent those breakouts related to like staph bacteria, because it does have some antimicrobial properties as well. Fanning the skin is another option if you're able to. I know it can be kind of odd to suddenly start fanning under your arms, but if you're able to carry like a fan with you, make sure there's good circulation over the skin surface. That can really help cut down on the accumulation of sweat on the skin. Those of you like myself who enjoy swimming in pools or going in hot tubs, if pools or hot tubs are not maintained properly, they become a breeding ground for a particularly gnarly type of bacteria called Pseudomonas, especially hot tubs. If hot tubs are not properly cleaned and chlorinated, they can really breed this Pseudomonas bacteria. In fact, there's a type of folliculitis related to this Pseudomonas bacteria in hot tubs called hot tub folliculitis, where patients develop these painful pimples of folliculitis related to this bacteria. So first and foremost, don't get in a dirty hot tub. If you do have a hot tub at home that you use, make sure you're, you know, following the recommended chlorination guidelines and you're cleaning it regularly. Likewise, pool maintenance is really important for keeping the proper chlorination for the pool to prevent bacterial contamination. However, unfortunately, chlorine is also pretty irritating to the skin, which that irritation can end up making you more of a victim of bacterial folliculitis. So when you get out of a pool or hot tub, first of all, get out of your wet bathing suit, because the chlorine-soaked suit, the water and the chlorine rubbing up against your skin, really gonna disrupt the skin barrier, and it is a very easy entry point for bacteria and yeast to get into the skin. A lot of people who swim a lot will frequently develop folliculitis on the buttocks from sitting in a wet bathing suit. Or if you wear like a rash guard, for example, you'll need to take it off. Otherwise, people can easily get folliculitis like under the arms, where that wet chlorine water is being trapped up under the arms. So make sure you get out of that. Rinse the skin thoroughly, and then again, after you rinse off that chlorine water, apply a moisturizer to really help replenish the skin barrier. And last but not least, if you do have a painful pimple on the body, a folliculitis, try a warm compress. This can be really, really valuable for helping it to go away faster. Just take a clean washcloth, soak it in warm water, and apply it to the area. Hold it there for 15 to 20 minutes, and do this about 3 times a day. It will actually help the folliculitis clear up faster. Warm compresses. Now, if you continue to have these painful breakouts, these painful pimples, these painful bouts of folliculitis, definitely see a healthcare provider, and if necessary, be referred to a board-certified dermatologist, because there are, in many cases, you know, it might be necessary to have a prescription treatment, or it may be necessary to have the painful pimple incised and drained of pus and inflammation in order for it to heal. And the other thing is that a lot of people carry staph bacteria in their nose, Staphylococcus aureus, types of Staph aureus bacteria. They're colonized with it in their nose. And because they're colonized with it in their nose, they end up getting these staph infections on the skin, a staph folliculitis. They're a lot more prone to that. And their family members are subsequently more prone to that as well, or anyone who they live with, kind of becomes a victim of circumstance, if you will, of the staph bacterial breakouts. It, again, can be transferred from surfaces, towels, linens, and in these cases, you may benefit from having an antibiotic ointment prescribed to you that can be used to treat the bacterial carriage in your nose, to reduce the burden of bacteria in your nose, to help cut down on these breakouts. So yeah, that's the rundown, you guys, on the painful pimples on the body. They're not acne, it's folliculitis, totally different. Hopefully these tips are useful to you in understanding what to do to prevent this from happening and how to clear up existing painful pimples. Again, see a healthcare provider if things don't improve. I like to emphasize to you guys the point that, not everything that looks like acne is acne. A pimple, for example, that pops up on your face and doesn't go away, that's probably not acne. It could be a skin cancer. And another skin condition related to what we're talking about today is gram-negative folliculitis. Now, I have a video, which I'm going to put on the end slate, all about gram-negative folliculitis, what it looks like, why it happens, how to deal with it. So watch that video next, because I give a lot of helpful info in it. But if you guys enjoyed this one, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.